good morning. Today is October 16, 2023 at 9:36 a.m. Welcome everyone to the meeting. This meeting is the Board of Health meeting. It is following open meeting laws and is open to the general public. We will be performing an audio-only recording of the meeting. In attendance is Dina Amato, Dan Kelly, and all board members, Tom Evans, Danielle Clancy, and Jamie Ryan. Also in attendance is Olivia Johnson in the audience. She's a nurse finishing her, she isn't a nurse, but she's finishing her RN degree, and she is here just to observe the meeting. Do I have a motion to approve the meeting minutes from 9/11/2023? Motion?
Motion.
Second?
Second.
And vote?
Yes. Yes.
Yes, 3 yeses. Do I have a motion to accept the licenses as issued? Motion?
Motion.
Second?
Second.
Vote?
Yes.
Yes, 3 yeses. We will now move on to the health agent's report. Mr. Kelly, is there anything you would like to discuss before we vote on accepting the report?
Nothing really to add other than there's hopefully a good chance that we're going to get 1,800 free COVID test kits in the next week or so. I can't believe it, since we ran out, we have at least one visitor a day looking for test kits, which is surprising. So if you know anyone that's been asking around, tell them to check back with us in about a week, maybe 2 weeks. So other than that, business as usual. We have special town meeting coming up on the 30th. I'll be there, hopefully just in a watching capacity. And then we had our household hazardous waste collection day this past Saturday. Only 24 cars from Whitman, but 136 total. So Whitman was the big winner as far as the bill, but to be expected out of our own collection day. Other than that, nothing to add at this time. If anyone has any questions.
What's with the Cherry Street trash pickup?
Just a dispute over trash pickup that we got involved in for an unknown reason.
Okay.
That should be taken care of though.
Okay.
Basically, someone was parking their car in front of their own house, and the person didn't like it because that's where they had to put their barrels. So instead of just walk down the street 10 feet, they came in to complain.
Okay. And that actually should be directed at DPW, right?
Yeah, and it was.
Okay.
Yeah.
Great. All right, great. And the school inspections were fine?
School inspections went good.
Great. Any other questions for Mr. Kelly?
No.
Middle school cafeteria looks really nice.
It was?
Yeah.
Excellent.
As always.
Great.
And for the public who might be listening, you do kitchens only, correct?
Kitchens only,
We
correct.
only do kitchen inspections at the schools, yes. All right, acceptance of the health agent's report and re-file. Motion?
Motion.
Second?
Second.
Vote?
Yes. Yes.
Yes, 3 yeses. We will now move on to the public health nurse's report. She is not present. Is there anything you'd like to discuss? I do have a question. We discussed at the last meeting, I believe, the TB cases. We would like to know if this, again, I thought we were going to distinguish between whether these are new cases or
So basically, everything on here is new other than TB. I know it should have been clarified a bit better, which I'm going to mention that.
Okay.
However, everything on here is new except the TB. The TB that is here, there's just one case that's considered active. However, she's continuing to stay in the hospital, so there's nothing required from the public health nurse right
So
now.
this is the old TB case?
The old one, yeah.
So it's not a new?
Not the new, correct.
Okay, so, I mean, to me, I guess the best way to distinguish these.
I think to make it a little key.
I think if maybe she put the date next to them.
That too. So
You know,
basically,
this one began on such and such a date, this one began, that way we know.
yep.
That way we could, be able to easier track when they came in.
Absolutely.
And if the hospitals ask us, we could say we had one on this date, one on this date, one on this
Yeah, and I've been talking to Dr. Ina from Brockton about TB in Whitman in general. They are also having a pretty large uptick.
I know hospitals are. So.
Yeah, so
The hospitals, we've seen a little uptick in TB, and then the hospitals have seen a little uptick in TB. So we're trying to keep a little closer. We keep it, of course, we track them, but we're trying to keep a closer contact with the hospitals. And the Lyme disease, I just want to put it out there that Lyme is very active right now. We do have cases, and I just would warn the general public to keep on top of that and be protective about that. Any other questions? Public and health nurses? No. Report?
I have a question, Danielle. What the heck was it? Oh, what do they attribute TB to? Like, is it
They haven't come out.
pollution or something?
Well, they're kind of saying it now, so I feel more comfortable saying it, but basically a lot of it is people that have recently came to America.
The immigration.
Okay.
Public TB is respiratory. It's spread through respiratory droplets. But it's our cases here are usually really low in the United States. The other countries aren't as good at keeping on top of it and managing it.
Okay.
So that's what
Could it also be that somebody's gone to a country as a tourist and came back? Is that possible?
It could
Yes.
be, yes.
Possible.
But again, usually we're good about getting on it and getting health care quickly and staying so it doesn't spread.
Okay.
People come back from a country, they have a bad cough, they're not feeling well, they go to the doctor and it's managed and contained and tracing. Other countries, people don't go to the doctor, and so, but, we're just tracking it.
Okay.
We'll
Thanks.
see.
They do screen for that in primary care too, even for like a well visit. So if you go in for a checkup, they'll be have you travel to one of these countries where it's from and if so, then
And depending where you work, you have to get TB tested, either some
Schools.
jobs, schools you do, hospitals you do, medical workers, paramedics, you have to get
For
tested.
nursing homes, I guess.
Can't say for sure, but I would think, at least upon hire, I don't know if I really, but, depending where you work. So there's a lot of things in place to keep it under control in the United States.
Thanks.
Sure. Any other comments? No. Acceptance of the public health nurses report and read file. Motion?
motion.
Second?
Seconded.
Vote?
Yes.
Yes.
Yes. 3 yeses. At this time, we would like to begin discussion on internal health, board of health business. I've got nothing. Dan? Dan's got nothing. Okay, we can pass over that. At this time, we'd like to discuss the current COVID protocols and procedures. All right, last time we made a little amendment to our COVID protocol. I want to say that Dan and I do not make these protocols lightly. We put hours and hours of research and discussion into these protocols. We try to keep them as simple as possible and as easy as possible for everybody to follow and understand. We don't like a lot of ambiguity in them. We like them to be very clear and very concise. And that's how we came upon the original one. The amendment we asked you to make last time, I'm going to tell you the story now. We got word that someone called one of their work friends on, I believe, a Friday or Saturday and said, "Hey, I just tested positive for COVID." And their work friend said, "Oh gosh, I'm in close contact with you. I was in your office for a long time the other day. I gotta cancel all my plans." So they canceled their whole weekend plans. And then the close friend, the work person called back and said, "Oh, guess what? I tested again the next day. I'm negative."
Next day.
And then showed up at the work that Monday, no mask, no nothing. So that's why we asked you to make the amendment that if you're positive for 10 days, no matter what happens after that. That if you originally test positive, because the testing is really about how good you are at testing. And we figured, well, if that happened to one person, however it happened, it could be happening to others, and it probably is happening to others. So we added the amendment. We didn't see it as being a big deal. We just wanted to clarify that once you test positive, you're positive. That there's no gray area in here. You don't test again the next day and be negative. So that's what we did. Well, we never sent that upstairs because, and we got this kind of not directly, so we can't report it directly.
Mm-hmm.
We kind of heard it.
To make fun.
Right. Yeah. So we have heard that, and nobody has come to me or the board, being three of us directly, but that the TA and the attorney is very unhappy with that. That there are individuals or groups who are looking to be paid administrative time instead of using their sick time for COVID pay now. Because, originally when COVID first started, they had COVID time and they weren't paid for their sick time, they were paid for COVID time. So now they don't feel they should use their sick time. These individuals or groups feel they should they should be given administrative time for COVID. This is not our business. And this is not our problem at all. We are an independent policy-making board. I don't normally like to bow to pressure at all. I'm a little upset that, again, there's nobody here to discuss this with us. This seems to be the way that, these issues come up and nobody's here to discuss it with us. Nobody has brought this to me in person. I think the TA had a brief conversation with Dan about it, maybe.
Yeah.
So we have queried other towns, and what the attorney has advised is that we follow the CDC guidelines. Now, if you have read the CDC guidelines, they're a little ambiguous. You are able to test out, possibly, and I know why they did this. They did this for healthcare workers, to get the healthcare workers back into the hospitals during COVID as quick as they could. And I know that's why they made this like this. But okay, I don't think they were thinking of municipalities and could we get our workers back on the job. I don't think that was their thought when they were writing this. But okay, this is what we're stuck with. So we queried other towns, and a lot of other towns are just using the CDC COVID policy. So what I recommend, although I don't like the way this came about to us, I do recommend two things. One, that we adopt this COVID policy from the CDC, and number two, that, and I think we're gonna have to do two motions on this. Number two, that no one from the Board of Health office at all, including the public health nurse, interprets or advises on this policy, since it is not our policy. That we advise people to either seek help from the CDC, or we advise them to seek help from town legal advice and through the TA. Because we didn't write this policy, we have no advice on it short of what is strictly written on the paper. And we're not going to interpret it other than what's written on the paper. So that is my advice, but I'm completely open to suggestion here and comments.
As a primary care provider, we would be interpreting this and writing these guidelines in a note for patients. So that would be another option, like see your primary care, and they can advise you when you can return to work. And then you go through like the first day of symptoms versus first day of testing. And I think that would be a change from our current policy because we decided to adopt day of test, not first day of symptoms. That's day 0, correct?
Day 0 is the day you were tested. Yeah.
Or the first day of symptoms, according to the CDC. I think according to our policy as it is now.
If you test positive, if you test negative, it's the day you tested. If you test positive, it's the day of symptom onset. You know, my real hang up of this is,
Only, if I can, the only other issue with us trying to interpret it it's one thing if it was Dina that was like, okay, so what do I need to do for me to be able to say, all right, sit down with Dina and go over it and do it. Then it's one thing if it's someone from a different department in town, police, fire, DPW, because they have their own separate union that they collectively bargain for and step out on. So that's the reason basically why council said if you guys just adopted the CDC guidance, it would make things a lot more simpler for all parties involved. The other question was with the CDC guidance, which is another reason why we just want it to be up to council at this point, is who's gonna say I tested positive, I come back, and on day 6, I'm like, well, I want to stop wearing a mask here. Let me test on day 6 and day 8. Who's providing the test? Who's watching me do it? Or is someone administrating the test for me? So that's all the questions and concerns we originally had, which upstairs heard that and understood. However, they're getting told by council things will be a lot simpler if you just follow CDC's guidance. So upstairs, then let's listen to council, which I can understand why that would be their opinion. And at this point,
so we are not going to test. We are not testing. We are not interpreting tests. We are not judging how people did their tests.
It would seem if we adopted the CDC guidelines, we're being cautious, and it takes out all the issues that Dan talked about. The whole process of testing and so forth is really subjected to proper administration of the test, interpretation of the test, honesty, or the honor system in terms of exactly when you want. And I think there's a lot of possibilities of people trying to say, well, I can cut it a couple of days short because I got to do this, I got to do that. And that, if we adopt this policy, we get away from getting involved in things that we shouldn't get involved with, quite frankly.
Well, you can cut it short here if you have access to antigen tests and you have 2 sequential negative tests 48 hours apart. You can remove your masks in the daytime.
But that still
Under
would
this policy. That's
kind
what-
of apply to the situation that,
No.
because you can't
No.
test on day 2. You
Yeah.
have to wait
Right.
until after
Right.
day 5.
Right.
So if, you could possibly be removing your mask like day 7, not day 10.
the fact of the matter is, if someone tests positive for COVID, no matter what the policy is, that situation can still occur.
Yeah,
Like
it will,
Tom said, it all comes down to the honor
Right,
system and
right.
people just being
Right,
honest.
it could still happen.
Yeah.
People, yes.
However, this,
Right. I don't think it's a bad idea. I just don't want our office to be called and asked to interpret this because
it's not our policy.
it's not our policy and I think it's a lot to interpret.
If it's not our policy and we adopt it, it is our policy though, right?
It is our policy we're adopting, but we didn't write it. So, and it's a lot. I mean, it is a lot. It's a lot. It's not,
I mean, and the fact of the matter is, already with the policy we have, things have already gone a step ahead and gone to legal, which will continue to happen.
right.
So if they're not gonna really take to and wait the policy we
Right.
wrote, I'd
Right.
rather
If
than
you
just
want my
use the
opinion, I
CDC
think they're already
guidance.
using this with us.
You do.
I do. I'm not sure, but I have a feeling that's what they're doing.
it kind of puts us in a position that we can't win in some ways.
Yes,
Because if somebody is, I'm not gonna say dishonest, because that's kind of accusatory, but if they're not aware of when they might just think it's the sniffles, and they might go to the 34th day, and then they do that, and then they feel fine because they actually started earlier, and they break this policy.
Yeah, I
What do
mean,
you do?
I don't
Well, we-
doubt that someone could break the policy unattendedly. Like
Right,
they're sick
right.
and they think, oh, I have a cold, and then it's lingering for a while, so they test. That's one thing. That's excusable in my
Sure,
opinion.
yeah.
If you didn't know,
You don't know.
that's okay. This person, however, tested positive, told somebody, I'm going to be out, and then maybe changed their mind a day later and decided, actually, no, I don't want to use 5 days vacation. You know,
5 sick days.
yeah, 5 sick days. And
Yeah.
If you could only look into the mind of all these people, it'd be easy, but you can't. But I think you protect the workers who are here, and the policy is.
Right. Now, and that's why we added that little thing on, just to present some clarity before. Not to accuse anybody, but just to put some clarity on. But no, and we can never, like when they test again on day 6 and 8, we can never know how well they're testing. I mean, your test is only as good as you are doing it.
I find it hard to believe that most people, too, that are administering a rapid antigen test themselves are doing it properly.
Right.
I know when I have done them in the past, I don't do them myself because I know I won't do it properly.
I
So,
won't ask why, but
Get that thing up in your brain, basically. It's tough to do it yourself.
so that's where we're at. And sometimes things on this board, especially during COVID, we often felt like we were kind of in a pressure cooker and couldn't win
Crossfire.
either. Yes.
Yeah.
During COVID, it was like that a lot.
Yeah.
So, I guess my suggestion is, we'll do whatever we vote, but we adopt this. This is what most towns are using, and that I think we should have another vote that we don't interpret it, that if people have questions, they can call the CDC or legal, because apparently legal's highly involved in this now.
And potentially could continue to be.
Exactly.
We're not lawyers, we're not doctors.
Right. We're the Board of Health. We try to make things simple and kind of get burned for it, so. All right,
Got fire.
do I have a motion to accept the CDC's isolation precautions for people with COVID-19 dated May 11, 2023?
Motion.
Seconded.
Okay, vote?
Yes.
Yes.
3 yeses. Do I have a motion for the board to, for the Public Health Office, Department of Public Health here in Whitman, and public health nurse, including administrative assistant and health inspector, to not interpret the CDC policy, to take it as it's written. If there are any questions, direct them to the TA and legal for the town of Whitman.
So moved.
Second.
Vote?
Yes.
Yes.
Yes. Okay, I just want to add to that feel free to advise people to talk to their doctor as well. Okay? All right. All right, this one we will send upstairs. The other one never was made official because we never sent it upstairs. There's a board of selectmen's meeting tomorrow night. So we will get that up before then, right?
Yep.
2023, and I'm sorry it's been also confusing everybody.
Sorry.
At this time, we need to schedule our next meeting. On November, oh my gosh, really? Seriously? Anybody have any ideas? The 20th is Thanksgiving week. The 13th,
I could do the 13th.
is Monday still the best for you?
Yeah,
or-
Mondays are good.
Okay.
Yeah, mornings are good.
Okay.
Fine.
The 13th? Okay.
9:30?
Yep, 9:30 a.m. on November 13th. And does anybody else have anything they'd like to discuss or any comments?
No, I do not.
Anybody? Questions? Okay, if there's nothing further to discuss at this time, we will adjourn the meeting at 10:01 a.m. Motion?
So moved.
Second? Vote?
Yes.
Yes.
Yes, 3 yeses. Meeting is adjourned.